5 early signs of gastric cancer. Gastric cancer might not be the most common type out there, but it's still a serious health concern. In 2025 alone, around 30,300 people in the US have been diagnosed with it. And sadly, over 10,780 lives have been lost to this disease. But the good news is that stomach cancer can be treated if it's caught early. The problem is that it's often detected too late. That's why, in today's video, we're breaking down 5 early warning signs of gastric cancer that you need to know. Don't skip any part of this video. This information could save your life or help someone close to you. But before we get into the details, here's something important. Every detail you're about to hear comes from hours of careful medical research. No shortcuts, no ChatGPT content, just solid, helpful information that could help save lives. Trust me, you'll want to stay with us for this one. 1. Persistent mild indigestion or heartburn. Persistent heartburn might seem like a common annoyance, but when it becomes a frequent uninvited guest that doesn't respond to your usual antacids or lifestyle changes, your body might be waving a red flag. While occasional heartburn after a spicy meal is normal, new and persistent indigestion that lasts for several weeks deserves your attention, as it could be one of the earliest signs of gastric cancer. Medical research has shown that chronic inflammation of the stomach lining, which often presents as persistent heartburn, can sometimes indicate precancerous changes. This is particularly true if you're over 50 or have a family history of gastric cancer. The burning sensation might be accompanied by a sour taste in your mouth, or a feeling that food is coming back up, especially when lying down. Here's what makes this symptom particularly concerning. Unlike occasional heartburn that might flare up after certain foods, this type of indigestion often occurs regardless of what you eat. You might notice it's present even on an empty stomach or first thing in the morning. Some people also report that it interferes with their sleep, forcing them to prop up their pillows at night for relief. If you've been experiencing this kind of persistent heartburn for 3 weeks or more, especially if it's a new development in your life, it's worth having a conversation with your doctor. While it's more likely to be something less serious, catching gastric cancer early significantly improves treatment outcomes. 2. Early satiety. Have you ever noticed feeling uncomfortably full after just a few bites of food? This sensation, known medically as early satiety, might seem like a minor inconvenience, but it could be your body trying to tell you something important. When gastric cancer develops, it can cause changes in your stomach lining that make it harder for your stomach to stretch and accommodate food like it usually does. Your stomach is like a flexible balloon that normally expands easily when you eat. However, when cancer affects the stomach wall, it becomes more rigid, like a balloon that's lost its elasticity. This means you might feel stuffed after eating just half a sandwich, when previously you could easily finish a whole meal. What makes this symptom particularly concerning is how it develops gradually. You might first notice yourself leaving food on your plate more often, or feeling uncomfortable during meals that used to be enjoyable. Some people brush this off as stress or aging, but these changes shouldn't be ignored, especially if they persist for several weeks. Some people even report feeling full before they start eating, almost as if their stomach is already occupied. As cancer cells grow in the stomach wall, they can cause inflammation and thickening of the tissue. This doesn't just affect how much your stomach can stretch, it can also interfere with the normal signals your stomach sends to your brain about hunger and fullness. 3. Unexplained fatigue and weakness. That bone-deep tiredness that coffee can't fix might be more than just a result of your busy schedule. When gastric cancer develops, it often causes a special kind of fatigue that feels different from your usual end-of-day exhaustion. This persistent weakness can sneak up on you, making everyday tasks feel increasingly challenging, even after a good night's sleep. What's happening inside your body is quite complex. Gastric cancer can cause tiny, slow bleeds in your stomach that you might not notice in obvious ways. Over time, these small amounts of blood loss can lead to anemia, where your body doesn't have enough healthy red blood cells to carry oxygen effectively to your tissues. This explains why you might feel winded walking up stairs that never bothered you before, or why your usual activities leave you feeling drained. The fatigue often gets worse because of how gastric cancer affects your eating habits. When you're eating less due to discomfort or early fullness, your body isn't getting the nutrients it needs to maintain your energy levels. This creates a double challenge. You're losing blood slowly, while also not getting enough nutrients to help your body compensate for this loss. What makes this symptom particularly tricky is how easy it is to blame on other things. We live in a world where being tired is almost expected, but this fatigue is different. It's persistent, doesn't improve with rest, and tends to get progressively worse over time. 5. Changes in taste preferences. Have you noticed that the steak you used to love now seems unappetizing, or your morning coffee suddenly tastes different? When gastric cancer develops, it can cause subtle changes in how your brain and taste buds interact with food. This isn't just about foods tasting slightly different, it's about developing strong aversions to foods you've always enjoyed, particularly meat products. The science behind this change is fascinating. Gastric cancer can alter the way your stomach processes proteins and affect the production of certain digestive enzymes. This leads to changes in how your body perceives and processes different tastes. Many people report a particularly strong aversion to meat, which might start as a mild dislike and gradually develop into a complete avoidance of certain foods. These taste changes often come with other subtle shifts in your eating habits. You might find yourself preferring blander foods or notice that certain textures bother you more than they used to. Some people describe a metallic taste in their mouth, while others say food simply tastes off in ways they find hard to describe. Medical research has shown that these taste changes aren't just psychological. The cancer can trigger inflammation in your stomach lining that affects your taste perception. This is different from normal preference changes that happen as we age. It's usually more sudden and specific, often focusing on particular food groups rather than a gradual shift in overall preferences. 5. Mild nausea that comes and goes. When you sleep, your stomach produces different amounts of acid and digestive juices than during the day. If cancer is affecting your stomach lining, these normal processes can trigger mild nausea that's most noticeable when you first wake up. Unlike the nausea from a stomach bug or food poisoning, this sensation tends to be less intense but more persistent. Medical research shows that this type of nausea often has specific patterns. You might notice it comes in waves throughout the day, sometimes triggered by certain smells or even just the thought of food. Some people find that eating makes it temporarily better, while others feel worse after meals. This unpredictability is part of what makes it easy to dismiss as stress or dietary issues. The nausea associated with gastric cancer often differs from other types because it doesn't completely resolve with typical remedies like ginger tea or anti-nausea medications. While these might provide temporary relief, the underlying sensation tends to return. This persistence, especially when it lasts for several weeks, is what makes it an important warning sign. If you've been experiencing this kind of mild but persistent nausea, particularly in the morning, for more than a few weeks, it's worth discussing with your healthcare provider. Have you noticed or experienced any of these signs? Let us know in the comments. We'd love to hear your thoughts. And if you found this video helpful, make sure to hit that subscribe button so you never miss out on more insightful content. We've got plenty of valuable health tips and expert advice coming your way.